podcast brought to you by the Triad Network. This podcast is designed to share trending topics occurring within the world and our communities and bring them a behavioral and mental health perspective.
Welcome to Behavioral Health Today. I'm your host, Dr. Graham Taylor. In our graduate education and professional training, the majority of our learning typically takes place at a reading, lecture-based, and discussion level. And if you're lucky to be invited into a supervisor's live session, you might get a brief glimpse of what a presenting problem and a diagnostic picture presents as. But what if you could learn from dynamic videos with highly talented actors portraying patients with various diagnostic presentations to include a therapist interacting with them? These visual guideposts and demonstrations could really accelerate, enhance, and increase the enjoyment of your learning process and a better understanding the mental health diagnoses that we address every day. Well, creating a learning opportunity like this is exactly what my guests today have done. Andrew Rubin and Dr. David Paltin have created Symptom Media, an online mental health continuing education course collection and film library available by subscription. Symptom Media's mental health continuing education course collection offers nurses, doctors, psychologists, counselors, and other healthcare professionals accredited courses built around Symptom Media's library of DSM-5 and ICD-9 guided video case studies and assessment tools. Andrew is the president and co-founder of Symptom Media and manages all aspects of Symptom Media's marketing and content creation operations. In addition to his role as president, Andrew lends his screenwriting, directing, and editing services to Symptom Media, where he works with subject matter experts in all aspects of film production. That's resulted in over 1,000 films being produced. David is a psychologist in practice and consultation for nearly 30 years. He maintains an active clinical practice and teaches psychology at Chapman University and Columbia College. David's clinical specialization is in the areas of pediatric diagnoses and treatment, sleep disorders, and violence prediction. And I also just learned today before the show that we have roots here that we share in Hawaii, where I live. That's a pretty cool thing. Yeah. Andrew and David, welcome to Behavioral Health Today.
Thanks, Graham. Yeah,
thank you. It's great to be here.
It's great to have you both. Guys, let me start out by saying today, your program is incredible, truly. In prep for today, I watched numerous videos covering just a variety of diagnoses. They are dynamic, they are powerful, and so illustrative of the topics practitioners address every day in mental health. So as we talk about the trends in mental health education, which is our focus for today, share with us what brought you both together and how this vision for Symptom Media originated.
Yeah, absolutely. I guess I can kind of go a little bit even further back and just even talk about sort of how first Symptom Media came about and then how Dave and I linked up and how we started working together. So
awesome.
Yeah, and so actually Symptom Media really began the initial concept with Dr. Donald Fidler, who was a professor of psychiatry and then interestingly enough also of screenwriting and acting for over 35 years at West Virginia University. And so he just did this really interesting thing where he would merge those disciplines together, where he would write these video case studies that his acting students would then use to portray symptoms unfolding in a clinically accurate way. And then he would use them with his psychiatry courses and with his rotations. And this would help students, see the various clinical cases, and they would use them to really sharpen and improve their clinical skills. So he was doing that really interesting work at West Virginia University. Kind of fast forwarding a little bit here, I was actually doing my thesis film at NYU, which dealt with some mental health issues. And I really wanted it to be clinically accurate just from my own side, from a filmmaker and a storyteller's perspective. And that led me with another family friend who was in the Department of Psychiatry at UCSD to introduce me to Dr. Fidler, knowing the work that he was doing, because they were both in the Association for Academic Psychiatry. And that led to this really interesting collaboration when we met of how do we bring mental health professionals and filmmakers together to really create these interesting clinically accurate videos. So that's how Symptom Media was
fantastic.
Born. And so it was sort of like realizing that partnership was really not seen in any way, especially for education. And now, we officially launched the company in 2012. And so over the years now, that collaboration has brought in other subject matter experts and has grown to over 1,000 films. And in over the 8 years that we've been around, we're now in at least 400 universities, medical schools, and colleges that have found the use in these films and bringing them into classrooms and sort of bringing what Don Fiedler started and really kind of expanding it to a global reach, really, because there are international schools that use this and everything.
I would like a little bit later on in our talk to come back to you both and ask about, who is using your videos and how are they being used? So where along the way did you bump into David?
Yeah, so I'll also tee it over, of course, to Dave as well. The interesting how we actually connected was during one of the production of one of our video case studies. This is kind of the funny way we met, which has been fantastic, was Dave's son is an extraordinarily talented actor.
Oh, and we
were working with him on autism spectrum disorder on a video case study. And of course, Dave and his wife, Caroline, were also there on our set in our little studio that we had. And working with his son, I cannot emphasize enough how much it blew us away. I think he's to this day, I think one of the most profound performances that we have achieved. And working with Dave and Caroline and Don, Dr. Fiedler, and his son, we were able to actually create something really dynamic where we took the same video case study of autism and then ran it through various presentations of different ways that autism spectrum disorder could unfold within one situation, one story. So anyways, that led to just working with Dave on set. We were like, oh my God, we have to continue this in other
capacities. So good.
Yeah, that was a rough day because he had to do about 4 or 5 different levels of autistic impairment. So yeah, there was a lot of work involved in that.
Andrew, before you came on today, I was talking to David and I watched his son first. You guys have a great opportunity for listeners. I would encourage you to go on to symptommedia.com. I'm going to get more resources at the end of our show today. But when you go on their site, you get to see a great handful of trailers for various diagnostic presentations. And you get to see them and the actors portraying. And I'll talk about one of them I watched that was just so very, very moving and so accurate. But I watched David's son, and truly, Andrew, I agree with you. I was blown away. Just unbelievable acting in that. And he was so accurate in the things that he portrayed. But David, you're saying he did five different components of that spectrum, huh?
Yeah, that was an all-day process, and I don't know why we chose to go from more severe to less severe, but that was the direction. And it was just kind of finding that zone. And Caroline and I are both psychologists, and so we I guess we were helicopter therapists in that sense. Yeah, and kind of coached them along with that. Mm-hmm.
Yeah, it was really, really good. Describe for our listeners the various aspects of Symptom Media, both your CE program and also your video library, and what they would experience if they were to participate in your program. One, what are they going to experience just in general? But maybe we can segue into some of the uses of your program and where it's being used, where it's impacting learning processes. So maybe kind of combine the two.
Sure, absolutely. So when someone subscribes to Symptom Media, recently we have sort of expanded to provide continuing education courses. So really actually, and we can get into that more about how professors have been utilizing Symptom Media, because that was sort of the inspiration for bringing what the utility of Symptom Media has been in the classroom into our library, providing wraparound curriculum. So in terms of if someone is to access Symptom Media's site, they're going to have over 600 films that are DSM-5 and ICD-10 guided. So they really sort of explore all different diagnoses and assessment tools as well. So how that library works is we explore different subject areas. So we have an entire series on, PTSD and trauma, military and veterans issues, eating disorders. It really runs the gamut. We explore some issues of violence, bipolar. Yes. So all of those are available. And then some of the things as we've grown, and we really sort of solicit and welcome a lot of feedback. And that's how we sort of expand and move into different subject areas in our library. Yeah. A lot of professors will say, these are great. We'd love things to have more comorbidities and really kind of dive into the messiness that is life, that when you're working with these patients. So tackling issues of addiction that also have issues that deal with trauma and homelessness. So we have all of those videos in the library, and some of the things recently as we've grown and expanded and brought in that feedback, we've done these video case studies where we have our core scenario of that actor doing a clinically accurate presentation of a certain diagnosis. And then we'll also have that actor then go through various assessments. So then, people that want to actually see what it's like to do maybe a mental status exam for that patient, or run them through a depression assessment, or sometimes we do some of the different alcohol or substance use assessments. So, hopefully people will see that as a very diverse library, both in terms of the diagnostic side,
Right.
but then also in terms of the patient side. We also don't really want to fall into any stereotypes with who these people are or might think they are, so that you get a wide variety of clinical representations.
Yeah. That's really a thorough kind of almost, putting someone in character and kind of getting them ready for the process and letting them really feel what it's like to be in that role. David, I know you do primarily the content work with subject matter experts. Talk about your components that you bring to this whole process.
Yeah, well, but one of the strengths that I think Andrew didn't mention is that they're very good at spotting emerging populations, and then tailoring videos to cover things that we're actually dealing with in the field right now. So it's important to kind of keep pace with everything that's happening, especially now. We have the pandemic that we're at some stage of either coming out of or that. And so we'll start developing courses on illness, anxiety disorder, and that sort of thing, the thing that clinicians are going to actually be seeing. But the other part of the process is to really talk about, get into the weeds about, what these people actually look like when they walk through the door, because we have to be accurate. That's true. And we have to represent the diagnoses and the different conditions as they are. But we also have to represent the human being that comes to therapy with these conditions, and how did they present. And so it really is a process, getting closer and closer to what clinicians' real experience is going to be.
That's really good. I want to talk about some of the various learning opportunities that take place as folks watch this to, increase competence and awareness of things in just a minute. But as you're talking about the content being developed, these videos, folks, as you're listening, they are really good. In fact, some of them are really moving. I had watched the trailers, I might have mentioned earlier, regarding the female athlete with trauma, and it was moving. It was so powerful. And I've dealt with a lot of trauma, and that was a real presentation right there occurring, and such a great learning opportunity. Tell me, how do you select your actors, and what's the process in their preparation? You give us a little bit of a process of preparation there, Andrew, but how do you select these folks?
Sure. Well, we do all of our filming in LA, so there's no shortage of actors.
There's no shortage, right? That's good.
And or therapists.
Yes.
Or therapists, exactly.
So, I mean, there's a bit of like, I guess, a secret sauce magic of it. Well, we work with a lot of the different subject matter experts, and so we bring in and we kind of create these case studies and scenarios, scripting them, working with our experts. So we have our stories, and then when we go out and we sort of submit the net for casting, actually it can get quite overwhelming. Our last round of filming, we had over 1,000 people submitting. And I guess not to get too in the weeds of the process, but we'll put together a side, which is what it's called for what actors will read when they're auditioning for a role. And, we try to put something together that will be really dynamic and sort of test their ability to sort of emotionally connect with a character. So we receive hundreds of auditions, and then it's really sort of a process of like figuring out who sort of might fit that role best with their acting abilities, with different diagnoses obviously represent really certain levels of empathy, or I have to say when we're working with doing bipolar case studies, for example, we also have to find actors who have the stamina, like the ability to really, because those can be so challenging to have that energy. And we've worked with some phenomenal actors that are able to do that for bipolar, and it is not easy as an actor to represent someone in manic.
Well, what you're talking about right now is what David said earlier. You really want to represent the human being, and you really want them to be able to present in a way that really captures what you see walk into the office. And when we just read texts or get lectures or have group discussions, you don't get a picture of what that's like until you actually, hung your shingle and are working in a setting where they walk in. And this is a wonderful introduction to kind of a real life person embodying these symptoms and signs and diagnostic presentations that we see in our practices. It's a combination of both of those things, isn't it? Not just the content, but trying to capture the human being as they present with his pictures.
Yeah.
Right. Yeah.
Absolutely. I mean, it's so important that we keep the humanity every way through the process, because ultimately the goal of these films is really to help people empathize and destigmatize these disorders. So yeah,
Can you talk about that piece just a wee bit? In fact, I think that's a great addition here. It's about destigmatizing these things. There's, this is not a one flew over the cuckoo's nest film here about, some out of control type things. These are very, very well done, and they capture really what these presentations look like. I've had opportunities to work in inpatient, state hospital, community mental health centers, private practice now, and these are what we get to see. And that presentation is very real. So David, you were even saying earlier, we want to kind of represent human being as we present this, but it is about destigmatizing something to us and letting someone see what's going to be in front of you as you treat them.
Yeah. I think, for any professor, you carry people in your head, right? You carry all of your clients that you've worked with. And when you try and represent those to students for training purposes, they come out and you try and find the best fit between a representation that's accurate, but one that gives enough diversity to help them understand those different situations that you're going to encounter just in clinical practice. So one of the challenging trends in education has been that we've moved more toward convenient learning and online learning programs and things like that. And so it's just a lot harder to do things like role plays in classrooms and to teach through modeling. And, as therapists, we're naturally empathic. We are really good at that. And that was a really good fit for us in terms of training to watch a professor or your instructor play out how to do a certain technique or how to deal with a certain type of interaction. And so this brings it back through Symptom Media.
We'll be right back after word from our sponsor.
Behavioral and mental health professionals provide critical support to our communities in a time when our communities need it more than ever. But they need support too, to continue their education, to connect with colleagues, and to advance their career. And so we've launched Triad, the hub for behavioral and mental health professionals. At Triad, you'll find education, community, and career resources for both current and aspiring behavioral and mental health professionals, all curated specifically for you and all for free. Visit us at hellotriad.com/BHT to register for your free professional account. Again, that's hellotriad.com/BHT. Come join the community today.
That's really good. I think the whole style of learning, COVID's kind of introduced us to it in a kind of a very broad way, but you're right, so many things going to things that are online right now. And there's some really impactful ways of learning. I've got a history of test prep and particularly in learning and memory aspects of that. And as I researched Symptom Media and what you guys have put together, there are so many benefits in terms of the learning and memory process, competency process, that your video learning approach really enhances. Things like reinforcing symptom recognition, assisting with the proper diagnoses, making some abstract concepts more concrete and more tangible to understand and really see play out. I love the idea that it supports visual learning. Not surprise video visual learning, but that's an enhanced way of learning that really stays with us. So you guys have got to be finding that the feedback you get is including helping raise the competency level, either of students or those that are taking your CEs as clinicians already. You've got to be hearing feedback about people's competence increasing.
Yeah, absolutely. The feedback we've been getting is amazing, and we've gotten a lot of it over the many years from professors who are using it, and of course now moving into bringing that experience the professors were doing in the classrooms into our CE courses. There's a lot of studies that show that different types of mixing up learning modalities, so it's not just written text, but giving that, having some visual and some written. And of course, it's just so much more dynamic than the standard couple paragraphs of a written text. And this just really can bring it to life. And you had sort of asked earlier a little bit of the utility, but I guess to sort of also tie that into this part of the discussion, it's really interesting. So professors, when using this in the classroom, sometimes it can be the anchor for a really amazing discussion leading up to what are the symptoms of the diagnosis, but how would you treat this person? Best practices. Sometimes it's even analyzing what would you do differently if you had this patient? And of course, allowing people to see these patients that they may not encounter for years after their education, but really to say what would you dig deeper into here? We have some suicide assessment videos, and some of the interesting ways that we do with those two is sometimes we do various versions of outcomes. Like sometimes the suicidal ideation can become different depending on if you ask the question differently or what you uncover. And even some of the interesting things that people do is they'll play our videos without sound.
Yeah, I saw that. That is so cool.
and
That's so cool.
It'll just be a discussion about like
Right.
the cues, the nonverbal cues, as well as sometimes with the verbal cues. And we also, just to say of this, the ways that we've adapted to how it can be used is we have an entire what we call the test section, which is the diagnosis is removed from the title, and then they can show it to students. How would you diagnose this? What are you seeing here? So that they don't have that like this is X disorder before they start watching.
There are so many opportunities to use this in the learning process. I love that part about turning off the audio and just watching the nonverbals to create a better understanding of the nuances and the cues and the things that are nonverbal in nature that when you read a textbook or the DSM-5 and you don't get a full picture. You get kind of a one-dimensional idea of what it is, and you hope that when you see somebody, you tend to kind of go through just the basic signs and symptoms, do you meet 5 of the 7? But when you see these pictures and when you see the actors portraying these things non-verbally and their facial features, et cetera, it adds a whole dimensionality that helps you understand. And I think more appreciatively, get a understanding for what someone's going through as they're experiencing these diagnostic presentations and these symptoms that they're trying to come, see you for. I also know you guys can weave these pretty easily into different LMSs, learning methods that folks have in their schools. And
oh yes, it's the whole integration. Our library is built so that people can incorporate it into their LMS platforms and their various learning systems. So they really can use these videos really to be as flexible for their curriculum and tailor it in any way. And I'll say as well, just on that note, in terms of integration in a classroom, we also really try to keep the videos on average length of 5 to 15 minutes because we just know also the time considerations for people in their classrooms, both on the learning side for CE courses to talk about that side, but also just for classrooms as well and people's schedule. And I'll also pass it over to Dave just to talk about in a second, but what we do with the CE courses, and when I say we sort of take what people are doing in the classrooms, is the core of every of the CE courses is taking the video case studies and then having real-time analysis from the instructors, which includes Dave, and that, starting and stopping and really being able to dive into the video case study in this dynamic way. And I'll let Dave talk about that process that is brought into it too.
I'd love to hear about it.
Yeah. So it's a matter of kind of focusing the lens into the case and what the person's presenting, and then back out again, and going through the DSM criteria or the points that students should be learning from the example videos. And so we're kind of watching and then learning, watching, learning, a very, very point by point kind of process of helping students understand, okay, this is how it actually looks. This is what to look for. These are some of the signs, and this is how the DSM translates it. Not always an exact translation. And so in a way, we're teaching them to have just the right spread of perception to put those two things together.
Yeah, that's really good. As a clinician yourself, David, and working with the content that comes into these videos, as you look down the road and you see kind of some of the expanding trends in education, but also just in mental health, what are you envisioning maybe some of the future videos, including maybe it's, comorbidity of something or dual diagnoses, or where would you like to see some of these videos go?
Yeah. I think there's a couple of challenges on the education side, just because, we've moved more toward convenience. And, traditionally, we've had a long time of practice, and then finally we'll kind of let students out there and do the work. And now it's a much more rapid kind of training. And so we really kind of have people practicing therapy in their early stages of work, really kind of out on a limb and needing more experience. That's the part that they're missing. And even though traditionally, that's at some point they're out there gaining that experience. That's why we call it practice, right? But, these days the trend is becoming shorter and shorter for the academic part. And so they're going out with less theoretical basis and understanding about technique and approach. And so, for example, at one place that I know about that has a master's in counseling program, they have, I think, 2 courses in counseling techniques.
Yeah.
And that's Yeah, if you think about going into your surgeon, right? So making sure that there's enough of those essentials in the videos is important to kind of counter that trend or help meet that trend. Also, we never know really what the emerging populations are going to be in our field, but we just know there's just going to be more and more need for mental health services. That's why when students are nervous about opening a practice or going into this business, I mean, I tell them, there's absolutely no reason to worry because, suffering is there and it keeps coming up in these different forms. So as we see things come over the horizon, so for example, with some of the military service related topics, we saw service members coming home and the statistics changing, and we'll kind of keep abreast of those demographic trends and the things that clinicians are talking about and try and see, okay, well, what's there and what's happening and what do we need to know? What do we want to know as a field in, 5 years from now when we're really dealing with this stuff hot and heavy?
It's going to be fun to watch what you guys track in terms of the trends and the emergence of various, diagnostic pictures and to watch how you guys get to respond to them around the content piece and the actors that capture the presentation of those. What do you think? I know we're kind of winding down for our time today, but there are a lot of CE programs out there and a lot of, videos of similar to what you guys are doing. But what do you think makes your program so distinct and unique from other training educational programs and CE programs out there?
Well, I think, first of all, it's the fact that we have these video case studies. I think, first of all, just the really bringing in these actors to sort of portray these very dynamic stories and being able to show what was mainly those sort of text-based video case studies. I mean, being able to watch a story unfold, to be able to see a clinician working to de-escalate a patient or intervene when they need to, and then having that in terms of the course of sort of that real-time analysis and breaking down these symptoms and what you're observing. And I think that does set Symptom Media apart. And the fact that we're really bringing in new subject matter experts and really diving into those emerging areas to really broaden the library as well. And I'll say as well that there's an important part of Symptom Media is we're really cross-disciplinary in terms of the use of these films. We really make this focused on the patient, on the story and the symptoms present. So that's why the people using this program, both on the university side and on the clinical side, we have nurses, psychologists, and medical schools, social work programs. It really spans the breadth of different clinical settings.
Fantastic.
I think one of the other things Andrew's not mentioning is that we're kind of best practices fanatic, and it can be a little bit difficult because we have to keep up with best practices in all these different disciplines. But they're very patient, Andrew and his team. And if there's a new approach that's come out or a new advisement that's come out, especially, with things related to pandemic topics and that sort of thing, then they'll wait and we'll make sure that we get it right rather than getting it out quickly. Really and good. So that's important, right, in our field is to make sure we're getting it right.
Yeah, well, they are authentic and they really distinctly capture the diagnosis that is assigned to each of those videos. And I can see how the use, the utility for a number of practitioners, as you're saying, Andrew, and just the quality of them, you're saying, David, is applicable for traditional and non-traditional teaching opportunities, for discussions being led for CEs and further learning. And just the application is pretty noteworthy. Guys, this is a terrific program. Congratulations on what you've created. What a fun partnership it sounds like you guys have, and probably some great experience. You guys probably have some great stories too about some of the filming processes, and must be a really fun process to be involved with.
Yeah, it's a really fun process. Also for the actors, I have to say, because it's so interesting and the different perspectives that I get to hear, because we work with LMFTs and psychiatric nurses and psychiatrists and psychologists, and everyone sort of has their own perspective that they bring to it. And then when we dive in with the actors, of course, working with them, I think some stories, I guess one would be our bipolar when we were working with Karen Silva to do that one. Yeah, that was after every break, it was like having to sit down, chug an entire thing of water, and then it was getting up, and it was because we had that as a script because it was very, very carefully scripted in terms of showing the presentation and having a lot of moments where Karen would have to de-escalate some situation. So it was showing hypersexuality. So we had, the script was probably about like 12 pages, But if anyone's ever seen a script, it was just pure text. It was just all text, because it was just all the things that, when we work on these patients, they're not based on real patients, but they pull in a lot of the real experience that these clinicians have had working with them. So it's also was a lot of fun and very, very funny to have to go through these things. But I guess that sometimes is real life too. So
I think one of the philosophies about it is that, since as clinicians we don't really get to choose who walks through the door. That's kind of the premise, that whatever diagnosis might be represented. And so there's a little mystery behind it, but that's the nature of our work, right?
Really
Not
true.
knowing exactly who the person is until we spend time with them.
What age cutoff do you guys have in your videos? Where does it kind of stop? Because I know you specialize in some pediatric things, David. Do you guys do any children or teens or?
Yeah, we have a good amount, and of course we're always adding more, and that's such an important area for adolescent and teens. And then just in terms of the process of creation, just like in, I guess, any Hollywood movie, it becomes kind of a sensitive subject. So we always like to have parents around. So we've worked with some really wonderful young actors, maybe 10 or under, but sometimes with a lot of the teenage cases, we sometimes will bring in a little older actors just so that they can have the maturity. And of course, the subject matter can be sensitive too, that we're working with. So, we don't want to traumatize any actors or have them kind of go through things that any actor can tell you that almost inhabiting a role is almost therapy in itself. So one of our hard and fast rules is, this isn't their therapy. We're not trying to traumatize them or have them bring in their own lives. So we really work with them to sort of build the world of this character that they will inhabit that is separate from theirs. So we have a lot of adolescent videos, and then sometimes some of the videos that are of those sensitive nature, because we've done some issues of violence, and sometimes we'll sort of maybe skew a little bit older in terms of the people that we'll pick for those roles.
It's an interesting dynamic, isn't it? When you start playing some of these things, they become real, whether it's, the Stanford, jailer and prisoner role, and those things kind of play out. Or David, I don't know if when I was in school, we would, every now and then kind of in a group class, have like a mock group therapy.
Oh yeah.
There is nothing, there's nothing mock about it. It is before one or two conversations back and forth, and you're in your stuff.
That's
and
right.
It's real,
everything spills out. Definitely.
Everything.
Definitely. Yeah.
And I will say, it's just in terms of when we're working with these actors and just almost circling back to where we started with Dave and his son. I mean, sometimes you just find that the talent of the actor sort of creates the space for sort of the magic to happen, where you find
so
these
good.
incredible, like, you're like, wow. I mean, part of working with, when we had Dave and his son there, and it was like, there's something special here. And what that one was, it was interesting. Yes, we sort of worked our way backwards. So we had him portraying someone with autism spectrum disorder, and was a very severe case, and then sort of subtracted symptoms. And then at the end, actually had him do the performance as just a teenager that wasn't on the spectrum. So it was almost jarring for us seeing that after working with him all day. And also I have to bring in, for one of Dave's courses, the opioid-induced depressive disorder that you worked on, and you broke down that video case study. The actress that we worked on there, when we started kind of diving in from the opioid use disorder video case study, and then exploring depression with the character, I mean, we were all sort of sitting there just like, just moved.
You are moved,
there are
absolutely.
a lot of layers to those cases, especially the substance use cases. Yeah.
Really good. Hey, I would love to let our listeners know how to get in touch with you folks, to get a sense of what Symptom Media is. Give us some resources and how we can connect with you.
Sure, absolutely. Anyone can go on to symptommedia.com and register for a free trial and reach out and contact us. We're always available. We receive emails and have dialogues with people using Symptom Media all the time. We really welcome that. And of course, on the website, we have articles and we have suggestions and some videos that show how people are using it. For example, we have a lecture from Professor Soltis Jarrett at UNC Chapel Hill, where she really expands on how she is using Symptom Media in her classroom. So we welcome everyone to come online and sign up, and they can, of course, get that access to try out Symptom Media for themselves. So
excellent. Very good. Anything else, David, you might recommend?
In terms of
any kind of resources that you...
Well, I think traditionally a lot of students had been accessing it through their school libraries and things like
Yeah,
that, students of counseling, but they have expanded into more continuing education and
exactly.
yeah, and so I think just going to the Symptom Media website and looking at
Perfect.
some of the sample videos and watching those, and you'll be drawn into it pretty quickly.
You will be drawn
Yeah,
into it very quickly. It's fun just to go down through the list that you can do a trial of, and you'll be drawn in very,
right.
very quickly.
Mm.
And there's something just kind of maybe in closing, you talked about wanting to kind of debunk or destigmatize some of the aspects of mental illness. And over the years, mental health has not done an overly good job of necessarily educating folks about what mental health is. And people sometimes have a biased and sometimes stigmatized view of what it is. We learn about, at least historically, mental health from like One Flew Over the Cuckoo's Nest, or if you're old enough, Bob Newhart or Kelsey Grammer. And it's just a little bit, kind of weird. But what you're showing is that in the presentations here, there's a human aspect that you are drawn into, and you get to see and appreciate that there is no stigma around this. There's an opportunity for people to be understood, to be helped, to be brought into a very healthy relationship with a practitioner, and that there is hope in the things that they're presenting, that they can reclaim or gain a really very potential filled life. And being
Yeah.
able to understand what comes into the office, being able to diagnose it appropriately is the
Mhm.
starting point for all of that. And you guys do a
Yeah.
great job of setting that cornerstone in place and making it so easy to learn it, so effective in learning it, and raising the competence and understanding even the nuanced pieces that are coming in. So extremely great, and truly that phrase you're drawn in, it is very true. So guys, this is a very, very well done program. Congratulations on what you've created.
Thank you
Yeah.
so much.
Thanks.
Appreciate it.
Yeah, it's outstanding.
Yeah.
Well, it's been great to have you both with us today. And I also want to thank our listeners. It's always great to have you join us as well. And we will look forward to seeing you next time on Triad's Behavioral Health Today.
We appreciate all the support from our community, and if you like our show, one of the best ways you can support it is by giving us a 5-star rating and leaving a review. Behavioral Health Today is a podcast part of the Tribe Network, all rights reserved.